Good morning, everyone. I wanted to touch base and kind of build up on the collaboration of anesthetic events for our patients and for your fur babies. This is usually a pretty it's sensitive subject in the sense that folks are nervous, which you have the absolute right to be, and the best way that I find to try to squash any nervousness or fear is with knowledge. And so I, as your pet care advocate, want to have some time with you to be able to explain some things. And I'm reading off of what has been written off of the American Animal Hospital Association website, which is called AHA, and we are an AHA accredited hospital, which means we are held to a higher standard of pet care. And one of those higher standards is communication. So I want to make sure that we are really open and dialoguing with you on where things are. So you'll see me reading from this page, and partly because the wording is extremely key and I want to make sure that you don't miss any of it, but it will be available on our website for you to be able to read on your own time and then reflect back on this video chat that we're sharing with you this morning. So part of the important things is that as a patient undergoing anesthesia, there is always risk, correct? And for that reason, your veterinarian is going to examine your pet, number one, and also run some tests. Typically, this is lab work. For some, it's also a urinalysis. We're also checking stool, just to help identify any possible risks. You'll hear me in my exam room say, want to make sure your pet's not keeping any secrets, right? And so these are one of the things where we need to make sure that the inside matches the outside before we're undergoing any anesthetic event with your patient and with your pet. So some of the secrets we're talking about are going to be, is there anything going on with their liver? Their liver is a very important organ to metabolize drug, and so that is something we need to know if we need to alter that. We also want to know, are the kidneys functioning properly? Is the blood clotting properly? These are all anesthetic risks that we want to be sure to avoid and be alerted prior to make sure that there is going to be no issue with that. So how are we doing that? We're trying to reduce that risk of complication. So it's really important that you are following the direction by your veterinarian regarding your pet's preparation for surgery. So before that day of the procedure, you're following every direction that you've received at your pre-surgical appointment. What's a pre-surgical appointment? Well, that's a full exam where we're also obtaining those lab samples and are actually giving you those results ahead of time before the day of, okay? This is partly why we try not to do a pre-surgical appointment the day of the surgery, because we want to make sure we have all those results in prior to the procedure. In the certain events that it's an emergency where we do need to have that procedure done at the same time as that exam, rest assured that the lab results are in prior to your pet being sedated at all. We don't want any surprises for your pet. Okay, so there are some things to consider. You might be asked to change the medications that are given to your pet, and we will be asking you likely to withhold food. Why do we do that? The main ideas and the reasons why is that when your pet is under anesthesia, their body may naturally regurgitate or vomit. And we do have a tube that goes into their airway, but if there's any regurgitation, there's a risk for an aspiration pneumonia, which is an aspiration of food or fluid into the lungs. Not supposed to be there. And that can cause some anesthetic complications where they could have difficulty breathing, they'll manifest with more coughing, or even require additional medications post-operatively. So when we're withholding that, that's the reason. Furthermore, they tend to relax, in the back end as well, just to try to keep it sort of clean. But it helps your nurse not have to clean up the cage with some possible poops that come out of there. So withholding that food is really helpful for them to be able to ensure that they're having a nice clean experience too. Okay. Older animals usually will have to fast longer than the younger ones. Puppies or even dogs with diabetes, we usually will say not to fast them because their metabolism is moving so quickly. And another anesthetic risk is low blood sugar. So we need to make sure that that patient is already optimized prior to. So really listen to what your veterinarian is saying as far as what is recommended for your pet. When we're reviewing any of the blood results, we talked about those labs, we're also considering some other things, such as the age of your pet, the temperament, the invasiveness, anticipated risks. We're already, your veterinarian's already been taught how this procedure is done, what to anticipate, what to expect. So that's the collaboration that you're getting. And so really listen at that point. If your veterinarian is feeling uncomfortable, this is sometimes why we'll call in a specialist to perform these procedures, because they have learned the specific nuances for certain specific types of surgeries. As a human being, you know that with surgeries you go to an orthopedist or you go to a special procedures person, dermatologist, or even a dentist has an oral surgeon. You don't have your general practitioner doing certain procedures for you. So it's the same thing with a dog, that there's a lot of things a general practitioner can do, but there are other procedures that it's in your pet's best interest to have that procedure done by a specialist. Okay, so do consider some of those things. We also, on the back end, what you should be able to expect is that the technical team that's supporting your veterinarian is also very well trained. These are where registered veterinary technicians are already schooled on what to look for while your pet is under anesthesia. They're monitoring heart rate, they're monitoring the breathing rate, they're monitoring blood pressure, they are checking IV fluid rates to make sure that the fluid therapy that your pet is receiving is keeping your pet properly hydrated, and also that the blood pressure is in its appropriate plane during anesthesia. Okay, so this is all the workup and the preparation that's happening prior to procedure. Now on the day, the nerves are high, but know that your veterinary team is very prepared and anticipating what's coming for your pet. And so what's happening on our end, we are already pre-planning the whole anesthetic event for your pet. We have every drug calculated. We have emergency drugs calculated just in the event that even though the blood work was perfect, some certain allergies or sensitivities that your pet may have that we can't predict, we're already pre-predicting and preparing with already pre-calculated medications to ensure your pet. We're also making sure the technical team, as I just talked about, is going to only be focusing on your pet's anesthesia, all right? One thing I didn't talk about is typically during anesthesia, because everything slows down, right? Heart rate gets a little slower, breathing slows down, that's very normal for anesthesia. They get a little bit cold, your pets get cold. And so that anesthetic nurse that's taking care, the anesthetic technician, not only are they watching that blood pressure, that heart rate, all the things I mentioned, but also the body temperature of your pet. They are not going to leave your pet until your pet comes up to the proper temperature, which typically for a dog is about, I would say about 100 degrees is what we have at our hospital, but between 99 to 101 is appropriate, and it's the same for a cat as well. We'll bundle them up, we'll call them burritos if it's a cat, or a fun little puppy taco. We give them super fuzzy blankets and we warm them up with some warm air just to slowly raise their body temperature up. Okay, so these are all key things that are anesthetic risks, because it will slow their heart rate down even more when they're cold, so we want to keep them as warm as possible. So that regular monitoring that our technicians are on top of your pet from start to finish to ensure that recovery is as uneventful as possible. So after the procedure, so let's say now the procedure's over, now your pet is waking up. And so we're making sure that your pet can walk out of the hospital comfortably, that they're not too groggy. They'll be a little tired, they might be a little tender, but they should be able to get up, not be stumbling, be able to possibly eat a little bit of a meal, be aware that you're calling their name. I think probably one of our most fun little tests is if with a Labrador, of course, or any retriever, you stick a little treat by their nose and you see that nostril start to flare. Yeah, they're about to come out of that. And so are the little puppies, you give them a little Cheerio, they're ready to go. And so we're able to see that they can be turned over to your care, where you can just love on them, put them on their fun little dog bed or in your lap and be able to recover. But also, it's important, again, to follow your veterinarian's instructions to continue the pain medication that they need, just to continue to progress them towards a positive recovery. And also make sure that you're getting some written discharge instructions and aftercare, because usually we will not reunite you with your pet until we've gone over everything, because typically there's a joyful reunion when you see your pet because you've missed them all day, and then it's going to be, what did Dr. Hatt say about that? What did the nurse say about that? We want to make sure it's all understood before you take over the care, because we've been watching your pet through the whole day, and we're, so to speak, passing the baton on to you to make sure that your pet is having a safe anesthetic experience. And so that is really the run-through through anesthesia and what to expect. Little nuances is that it's typically an all-day experience for your pet. If you are one that just has a lot of apprehension, or you just don't like to be away from your animal, tell the staff that. Okay, typically we will give you a little heads up and just an update every 4 hours. There are some that want it more, but you gotta tell us what you need, okay? We've already done our part to ensure that the preparation is set for your pet, but if you're needing a little bit more of a play-by-play, a little bit more, I just wanna know when my pet's going under anesthesia, I wanna know exactly when it's waking up, I wanna know, let us know, okay? Let us know, because that isn't every client that wants that. Some would feel like the less is best. Just tell me when to drop it off and when to pick it up. Everybody has their own different comfort levels. Just know that we go in being as prepared as possible to ensure that your pet will have the most successful anesthetic procedure every day. Thanks.